Hello and welcome back. It's Dr. Mulholland here in Toronto, Canada for an injectable facial shaping procedure. We are going to be using injectable RF Morpheus style. Quantum I would use on this patient when it's approved in Canada, the Quantum RF10 along the jawline. So we're going to use RF to reduce fat where I want fat reduction, the jowl, some of the malar eminence, to tighten the FSN, the fibroseptal network structures that have elongated and allowed the face to fall. So we're going to lift, reduce, and tighten with the Morpheus. We also might then be using the Quantum in markets where approved to reduce her jowl. Zoom in here a bit. So X marks the spot where RF, zoom in now closer, tighter, show me just the head and neck. Beautiful. And so we're going to use RF to reduce the jowl, tighten the jawline, reduce the NLF, come across the cheek with this effect with the RF. Two types of RF I could use depending on my country and regulatory approval. Come under the lobule and do the Quantum RF10, and the Quantum RF10, fast, effective FSN contraction, little fat reduction, and elevation. I would then come over top with the Morpheus to reduce and lift. And this part of the injection technique, the RF, will be the most important. Where you see hash marks, we're going to add a little bit of filler, chin down a bit, center down more. Under the eye, combination of reduction and tightening of the septum orbiculus oculi with Morpheus, and then volume. The one area, as shall be marked out, that we would add would be a little bit of supraorbital volume to get volumization and elevation of the tail of her brow. We're also going to use the Morpheus up here to tighten her frontalis fascia and get lateral brow elevation. She has that dolorous look, so we'll talk about that. But RF is virtually important at every zone. A little bit of submetal tightening with RF, and then between her sternocleidomastoid on each side, for that loose elastotic skin, we'll use the Morpheus. So the Morpheus plays out in virtually upper third, middle third, and lower third. The volume after the heat will be supraorbital, infraorbital, high zygomatic, not malar, and a little bit parasymphyseal. The rest of the jawline, medial midface, under eye and brow will be RF. On the other side, and again you can tighten in a little bit here. Perfect. Again, supraorbital volume, temporal hollow, and we'll use a little bit of volume there to help lift. We'll be using the RF to tighten the fascia of the frontalis and lift, and then we'll use toxin after heat and filler to uncouple depressors laterally, especially, and our corrugators centrally. In the midface, the tug-of-war, the commissure, after heat and tightening and lifting and volume, we use a little DAO toxin to allow the elevator to dominate over the depressor. And then RF, purely RF in the neck. So that will be our strategy here today. Now we want to make her comfortable.